Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gillian syndrome, we're looking at the mechanism of the immunopathies. So there are some following events which takes place in the Gillian syndrome, and it is mainly associated with the Campylobacter jejuni. So there's a Campylobacter. So there's something known as a Campylobacter jejuni. So Campylobacter jejuni infection. So there is something known as a B cell. So there is something known as a B cell. So this B cell, it recognizes the glycoconjugates of the jejuni. So B cell, it recognizes what? It recognizes the jejuni. So it recognizes the jejuni, and this is the we're writing as CJ that cross reacts with the ganglioside. It cross reacts with the ganglioside. So it cross reacts with the ganglioside present in the Schwann cell surface. So this is present in the Schwann cell surface, and also the adjacent peripheral nerve myelin, and also the subjacent peripheral nerve myelin. Next is we look at the most B cells. So then the most B cells are activated via the partially T cell dependent route. So B cells, so majority. So most means we have the majority of the B cells, they are activated partially via the T cell dependent route. T cell dependent route and secrete primarily IgG antibodies and secrete the IgG auto antibodies. So some B cells are activated via the T cell independent mechanism, secretes the primary IgM. So some of the B cells, they are activated by the T cell independent. So when it is dependent, it secretes the IgG. When it is independent, what it secretes is the primary IgM. It secretes the IgM. Now, moving further, let's look at the activated B cells. So there is something known as the activated B cells. So activated B cells, it escapes from the Peyer's patches into the regional lymph nodes. So it escapes from the Peyer's patches. So it moves from the Peyer's patch to the regional lymph nodes, to the regional LN, that is the lymph nodes. Now let's look at the activated T cells. So when you look at the activated T cells, they also function to assist the opening of the blood-brain barrier. So what they do, they open the blood-brain barrier. So function to assist the opening of the blood-brain barrier and facilitates the penetration of the pathogenic autoantibodies. So it facilitates. So what it does, it facilitates the penetration. So it facilitates the penetration of the pathogenic autoantibodies, pathogenic autoantibodies. Next is, let's look at the earliest changes, what is present. So when you look at the earliest changes in the myelin, so there are some associated with the earliest changes. So earliest changes in terms of the myelin. So earliest changes in terms of myelin consist of edema between the myelin lamellae. So there's presence of edema. So edema, it is present between the myelin lamellae, as well as the vesicular disruption, and this is of the outermost myelin layers. This is as present in the outermost myelin layers. Next, as we move on, these effects are associated with the activation of the CB5. So they are present with the activation of the CB5 to C9. So CB5 to C9 membrane attack complex, and they are mediated by this calcium entry, and it is possible that the macrophage cytokine tumor necrosis factor also participates in the myelin change. So what we see is, it is possible that the macrophage cytokine tumor, so macrophage cytokine tumor necrosing factor, so we can write it as TNF, necrosing factor. This also participates in the myelin damage. To learn and grow daily like this, please do subscribe.